welcome to the Health Talk. I'm your host, Cardine Thompson, and here today we have 5 prospective student nurses: Roshana Morris, Janelle Graham, Camise Miller, Gasiana Chambers, and Akelia Stanley. So today we have a letter written to us by Miss Shamila Richards. Dear Health Talk, my name is Shamila Richards. I recently visited the doctor because I was showing symptoms of sore throat, a little fever, and some white spots at the back of my throat. The doctor further told me I have Streptococcus pyogenes. Could you future nurses further elaborate on my diagnosis? So, Streptococcus pyogenes is a gram-positive human bacterial pathogen that causes a wide variety of infections, such as soft tissue infections and bacterial pharyngitis, strep throat. If left untreated, it may lead to severe symptoms like rheumatic fever, and other infections include the devastating flesh-eating bacteria, otherwise known as necrotizing fasciitis. Can you future nurses further elaborate on Ms. Richards' diagnosis, starting with Nurse Morris? How is Streptococcus pyogenes transmitted?
This bacteria transmitted. Streptococcus group A bacteria resides in your nose and in your throat. Group A Streptococcus is spread through droplets that become airborne from coughing or sneezing or by direct contact with the mucus. With that, you might breathe in the droplets if you're close enough to an infected person that coughed or sneezed. Additionally, the droplets may land on solid objects that you may later touch. This type of contact may also occur if the infected person blow their nose and touch the object before washing their hands. Either way, the bacteria is transmitted to your hands and in your fingers, and with you putting your hands and your fingers in your face, you will become infected. Pertaining to the skin, if the skin is infected, as with cellulitis or with impetigo, the bacteria must come in contact with a part of the skin that had an open area. This open area can be a cut, a scrape, or even a bite. This open area can be so tiny that you didn't even notice it beforehand. Something to note, impetigo is very common among young children. Reason being, they often share their toys and play together.
Thanks for having me, Nurse Thompson. Well, Streptococci is a facultative anaerobic organism that is spherical in shape and is founded in chain or in pairs. Group A Streptococci is commonly found at the back of the throat or on the skin. Vast majority of Streptococci are relatively mild symptoms such as impetigo and strep throat. Occasionally, however, these bacteria can cause severe infection such as necrotizing fasciitis, also known as a flesh-eating bacteria, and streptococcal toxic syndrome, STSS. In addition, people may carry Group A Streptococci in the throat or on the skin and display no symptoms of the disease. Invasive Group A Streptococci is a severe disease and sometimes life-threatening, which may invade parts of the body such as blood, deep muscle, fatty tissue, or even the lungs.
There are 3 types of infections. The first one being pharyngitis, also known as strep throat. It is an infection, of course, caused by Streptococcus pyogenes. If strep throat is untreated, it can cause severe consequences such as rheumatic fever affecting the heart valves and glomerulonephritis affecting our kidneys. What necrotizing fasciitis looks like in the earlier stage. Now, as the bacteria stays there left untreated, it can, as I mentioned before, it eats away the tissue, the muscles, the skin, hence giving you a picture, hence looking like the picture in the right. The other common infection is impetigo. Impetigo is a contagious bacterial infection that mostly affects children 2 to 6 years old. One of the bacteria, of course, that causes impetigo is Streptococcus pyogenes, and it tends to thrive in summertime. There are two types of impetigo. This is bolus impetigo and non-bolus impetigo. Impetigo, which is a fluid-filled blister surrounded by red and itchy, skin. But it is important to know that these are not sores. The blister may be large or it can be small, and after they break, they form yellow. The other type of impetigo is non-bolus impetigo. This is a post-fluid infection. It is itchy and appears honey-colored crust, but it is not painful. Now you have bolus impetigo, which is a fluid-filled blister surrounded by red and itchy, skin. But it is important to know that these are not sores. The blister may be large or it can be small, and after they break, they form yellow. The other type of impetigo is non-bolus impetigo. This is a post-fluid infection. It is itchy and appears honey-colored crust, but it is not painful.
Okay, so after contracting the infection, some symptoms you may have include throat pain. This normally comes on very quickly. After, you may have painful swallowing, tiny red spots at the back of the roof of the mouth, swollen and red tonsils, sometimes with white patches or streaks of pus, headaches, rashes, fever, body aches, nausea or vomiting, especially in young children. Some inflammatory reactions you may have include inflammation of the kidney, scarlet fever, which is characterized by a prominent rash, rheumatic fever, which is an inflammatory condition which may affect the heart, the nervous system, and the skin, post-streptococcal reactive arthritis, which causes inflammation in the joints.
The treatment for bacterial vaginitis is oral penicillin for 10 days or IM benzathine penicillin. This treatment is cost-effective and has a narrow spectrum of activity. In patients with penicillin allergy, macrolides and first-generation cephalosporins can be used. However, some strains of Streptococcus pyogenes have developed resistance to macrolides, and macrolides are used as third line of treatment for a streptococcal throat infection. Severe invasive Streptococcus pyogenes infections can be treated with vancomycin and clindamycin. Intravenous antibiotic therapy and surgery for the removal of necrotic tissues are recommended in the case of soft tissue skin infection by Streptococcus pyogenes.
So thank you, future nurses. I hope we helped Mr. Church to understand her diagnosis. It's time to wrap up the show, so we'll see you guys next week on the Health Talk. I'm your host, Cardine Thompson, and thank you for watching.